Hi, this is Alexandra with Telakai Health. I am a board-certified nurse practitioner and I welcome you to this channel. On today's episode, we will be talking about back pain. I hope you find this video very informative, and if you have any specific questions, please comment below and I will try to respond to them. You're probably here because you recently started having back pain. You started getting pain in your lower back. It could have just happened out of nowhere, or you had a recent injury that's causing you this discomfort. Well, the definition of back pain is discomfort and sometimes excruciating suffering that's linked to an injury or some other illness to the back. It can span from the shoulders down to the hip. Back pain is actually a very common complaint, and it is a leading cause of debilitation or disability worldwide. Your back pain can be acute, which means that the duration is less than 4 weeks, or it can be subacute, which means the duration is between 4 to 12 weeks. Or it could be chronic, which is when it's over 12 weeks of you suffering. Typically, the first episode happens between the age of 20 to 40 years old. So the good news is there are things that you can do about it to help relieve the back pain. Let's talk about the signs and symptoms. Back pain can be anything from a shooting pain and aching. It could be burning pain in your back or in the muscles in your back. The pain may extend down to your legs. It can be one leg or both legs. It may intensify the pain may intensify when you bend or when you twist or when you're standing up or walking. But most back pain improves over time, especially if you take care of yourself or do some preventative things, watching how you lift things or how you're sitting. If you do some home therapy, it usually goes away. If your back pain does persist, you will have to see a provider to find out what exactly is happening to your body. For example, if it's been going on for a few weeks now, if it becomes more intense, it does not go away with rest, or if it spreads down one or both legs, it causes weakness or numbing or tingling in your legs, that is a clear sign that you have to get immediate help, and which means going to your the emergency room, so that you can be evaluated. Back pain frequently occurs without a known cause, and if it's particularly severe, you will have to get imaging done so we can find out what's going on or what's the cause of the back pain. Back pain is associated with several conditions, and one of the main ones is straining of the muscle or ligament. The back muscle and ligaments can be strained by repeated heavy lifting or sudden uncomfortable movements. Constant tension on your back might create severe muscle spasms, especially if you're in poor physical shape. Another reason why you could be having back pain is due to a ruptured disc. The disc is a soft substance, and it might expand or rupture when you put pressure on it. And when that happens, that also puts pressure on your nerve, which causes excruciating pain. Another condition that causes back pain is arthritis, specifically osteoarthritis. In certain circumstances, arthritis in the spine can cause spinal stenosis, which is the narrowing of the area around the spinal cord. This is an alarming situation because if you're experiencing severe symptoms, you may lose bladder and bowel function, and even you can develop sexual dysfunction. Finally, osteoporosis can also cause back pain. Osteoporosis is when your bone becomes very fragile, very brittle, and any injury can cause a severe fracture. to your spine. So definitely that will cause back pain. And let's talk about treatment of back pain. The most effective therapy includes pain relievers, being active, completing specialized exercise. However, some people will require additional medical attention, which is where you may be referred to a physical therapist. A physical therapist can help straighten and stretch your muscles. One of the most effective remedies for back pain is exercise. A lot of people find yoga works or swimming helps. Physical therapists can help keep track of your exercise routine, keep track of your progress, and offer hands-on treatments such as spinal manipulation. An occupational therapist can also be involved with treatment of back pain if it's affecting your daily tasks like dressing up, washing yourself, driving. They can advise alternative methods to get these things done and provide you tools and technology to help, and especially to help relieve stress on that area. One of the last options is injections. Injections can be very helpful for more severe pain or sciatic pain. These injections are known as epidurals. They include a steroid, which is an anti-inflammatory medication, injected in the spinal area, which helps calm down the pain in that area. And sometimes you don't feel any pain at all. Sometimes it just relieves the pain for you know, a short time. There's different things that you can try. The good news is 50% of acute pain does go away by 1 week, and 90% of it goes away, resolves by 8 weeks. So, you know, hopefully you're not the person who develops chronic pain, and if you are suffering with chronic pain, there are things that you can do to help. If your back pain does persist and you feel like you need help, this is when telemedicine can help you. So please visit our website, telakaihealth.com, and you can set up an appointment to see a provider, which will help you with diagnosing you with back pain and getting you either medicine or therapy if needed. Well, that's it for me for today. I hope you liked this video. If you did, give this video a thumbs up. Do not forget to hit that bell icon to get notifications. If you have any questions, I will do my best to respond to them, and I'll be back with another fantastic video. Until then, stay tuned and take care.